Hi, good morning. My name is Dr. Guru Murthy, and I'm one of the assistant professors in hematology oncology at the Medical College of Wisconsin. I specialize in the areas of leukemias, particularly acute lymphoblastic leukemia. And I'm going to discuss briefly about some of the novel agents that are available for management of acute lymphoblastic leukemia in adults and how they are advancing patient care in this situation. So, generally, when we look into ALL, the thought process is usually patients need chemotherapy, bone marrow transplantation for cure. But there are more and more targeted agents which are actually trying to really answer the question of whether treatment needs to be that intense with many chemotherapies, or can patients still derive good benefits primarily with targeted agents with lesser chemotherapy. There are two approved agents for the management of ALL in the relapsed and refractory setting in adults. One is called blinatumomab, which is a CD19 targeted bispecific antibody. And there is another agent called inotuzumab, which is an antibody-drug conjugate targeting agent, a target called CD22. Both blinatumomab and inotuzumab have been compared against standard chemotherapy in ALL, and they have shown very good results, even better than chemotherapy. And both of those agents are currently approved for management of relapsed and refractory B cell ALL. But they're also being increasingly investigated in newly diagnosed patients with ALL. There are ongoing clinical studies where blinatumomab is being added to chemotherapy-based backbone to see if that would improve the response rates and minimize the toxicities. Same way, inotuzumab is also being studied in patients with newly diagnosed ALL in combination with chemotherapy to see if that could improve responses as well. There is another unique subtype of ALL called Philadelphia chromosome-positive B-ALL, where many of the approved tyrosine kinase inhibitors can be used in addition to either a chemotherapy-based backbone or a lesser intensive treatment-based backbone. And the question really is being asked in the setting of Philadelphia chromosome-positive B-ALL as well, in terms of whether one would need an intensive chemotherapy and a bone marrow transplant to cure the condition, or whether we could just use novel agents without chemotherapy and try to improve patient outcomes. For example, in the ASCO meeting this year, there was a very exciting data that was presented by Dr. Nicholas Schott from MD Anderson Cancer Center, where a targeted agent called blinatumomab was combined with a tyrosine kinase inhibitor called ponatinib, and this chemotherapy-free regimen was able to produce excellent response rates, and patients were able to actually tolerate the treatment very well without risk of mortality, as one would see with chemotherapy. So the data for a chemotherapy-free approach is starting to take a center role in patients with Philadelphia chromosome-positive B-ALL. And hopefully, when we have more approved data with novel agents combination with chemotherapy, even for other ALL subsets, lesser chemotherapy, more targeted agents would probably be the way to go in the future. There are also other novel aspects to improve outcomes for patients with ALL, including allogeneic bone marrow transplantation and CAR T cell therapy. In this ASCO meeting, we also had exciting data being presented about CAR T cell therapy by Dr. Shaw and colleagues for adults with relapsed and refractory B cell ALL. And that showed very good response rates and also durable responses as well in some of the very hard to treat patient population. So overall, the availability of novel agents are certainly advancing the care of patients with ALL. They are currently being widely used in practice in relapsed and refractory ALL, particularly B cell ALL. They are being investigated in clinical trials in newly diagnosed ALL. And hopefully, in the next few years, we'll start seeing more and more newer approved regimens where a novel agent is going to be combined with chemotherapy, hopefully with lesser chemotherapy, more reliance on novel agents, and hopefully that can improve patient tolerability and also their patients' life expectancy.